Hi folks, this is John Adamson, the Rehab and Documentation Guru. So my son, who is very disabled, is in the hospital right now. And I wanted to highlight a couple conversations that I've had. One actually went better than the other. So my son had back surgery, and he's got a lot of problems, including a lot of hypertonicity. He has contractures, and he had a thoracolumbar fusion. And so he's in a big teaching hospital, and the surgeon is an orthopedic surgeon. And anyway, the orthopedic surgeon has certain protocols that she wants to observe. And so she's encouraging my son, who has unique medical needs, to go through a certain clinical pathway in terms of you get him up day one after surgery into a chair, that type of thing. And knowing my son the way I do, and having had him experience previous back surgery, and knowing his medical complications the way I do, I know that that kind of approach, a clinical pathway, is not always relevant. It's not always appropriate. And so she had certain criteria she wanted to meet, including post-operative visits, post-operative care for his wound, his surgical wound. And so I presented her with various and sundry options that would be both reasonable from a standpoint that it would take care of the needs that my son has, and it would be addressed safely and effectively by perhaps other entities, like let's say a home nurse. And so anyway, we had some back and forth, and then the same case was with a physical therapist that was working with him in the hospital, and I explained who I was and a little bit about my background, and she was much more amenable to what I was talking about. But what I wanted to talk to you about today was the third leg of medical necessity, or evidence-based practice, I should say. There's three legs to evidence-based practice. One is the research that is done on different types of diagnoses and interventions, and usually by research authors, study groups, where large swaths or fairly large swaths of patients are looked at with a number of measurement parameters to determine efficacy of certain treatments. The other aspect of evidence-based practice is individual clinician experience and expertise. And so, after working 28 years now, I have a lot more expertise in the area of rehab than I had when I was a new graduate, even though I had more book learning, probably knowledge right after graduation, because that stuff was still fresh. With that said, those are two legs of evidence-based practice. The third leg of evidence-based practice is patient preferences and any cultural restrictions that a patient has. So with that said, I've often said that the third leg is the weakest of those three legs. However, it is very important that we as clinicians pay attention to that third leg and document accordingly and use it to guide in the best practice of our patients. So when this orthopedist is saying day 2 after surgery, the patient must be up in a chair, and I'm saying I know based on my knowledge of this individual patient, my son, that will not be clinically effective for him, the surgeon at that point is beholden to listen to that third leg of evidence-based practice. Now, I might say something like, well, I really think my son would do better if he just lay back and ate some cheeseburgers. Well, that's not evidence-based practice, and that's not going to work. But when I offer alternatives to getting up in a chair and say, let's just sit him up edge of bed for, supported with the therapist for so long per day, so he can have, for him, it's more of opening up his hip angle so he doesn't flex so much, and that'll support his pain management needs. We should listen to that kind of stuff. And so when you are seeing your patients and when you are supporting evidence-based care, make sure you're not using a cookie-cutter approach. And clinical pathways are guidelines, but they're not meant to be the end-all, be-all of our focus. How you dealt with patients in the past is one leg of evidence-based practice, but is not the end-all be-all of evidence-based practice for your individual patient. So make sure you listen carefully to your patients, your caregivers of your patients, the ones that have been around them for a long time, know what works, knows what doesn't. They may have some very valuable information to supply you with that'll make your care of the patient more evidence-based. And all three legs of that three-legged stool must be in place to provide the best care for your individual patient. Anyway, that's my rant for today, but it was also related to clinical and compliance related topics. Anyway, if you have any comments, feel free to leave them below. Please like and subscribe. And of course, you're always welcome to email me suggestions at adamsonenterprises1@gmail.com, adamsonenterprises1@gmail. Thanks so much. Make sure you get paid for what you do. Have a great day and God bless.